Welcome and introduction of new ICS members. I believe that Laura Jarvie is online. Is that right, Clarissa?
Karen Worthington is online and Laura's going to join us very shortly.
Okay, so Laura's going to come personally. Okay. Unfortunately, I'm still familiarising myself with all the faces that turn up to this committee. So forgive me if I'm struggling somewhat. But when I last chaired this meeting, I forgot to welcome Sai Ganarazan. Forgive me for an appalling effort at your name, but Sai is the clinical director for the East Merton Primary Care Network. He's been a GP for 14 years. He has a long list in his biographical details, but Sai, I thought it might be helpful for you to just say a few words about yourself so that those colleagues who don't know you as well have the opportunity to learn the important aspects of your contribution to this committee.
Yeah, thank you. So I'm Sai Ratnam, Sai for short. I'm a Merton GP. I've been a GP at Wideway Medical Centre, which is a practice in Mitcham and East Merton for the last 14 years. I'm also the Merton primary care provider representative, and I work also with Central London Community Healthcare as a divisional medical director. So I've got oversight of adult and children's community services in Merton. Really passionate about health inequalities as an East Merton GP. So really happy to be here, and thank you for welcoming me.
Can I say that, I mean, you're too modest to say that your practice is rated as one of the best in the borough, and I think that's important that we are aware of that. Particularly important that a practice in East Merton is providing such excellent quality care for the people living there, given the many barriers and difficulties that they face, and your commitment to tackling inequalities is much appreciated. So Laura is not yet here. Okay. But just when she does join, to let you know that Laura is a GP and clinical director at the Nelson, with particular interest in the role of physical activity in treating and preventing disease, paediatrics and women's health. So that's something as a committee we're all very interested in and want to see more of. So we welcome her. And Karen is
joining us online.
Karen is joining us as a full member of the Health and Wellbeing Board, but has often attended in the past, so she's more familiar with the proceedings of these meetings than I am. She's been a GP in Merton for many years and is currently working in a practice in Morden, so we've got a good spread, and that's good and healthy. So welcome to you all. Item 2 is apologies for absence. We have apologies from Sarah Gould, and Jane McSherry has given her apologies, and Elizabeth Fitzpatrick is joining us, and you're very welcome. And can I also say that Graham Terry, who's recently joined the Adult Social Care senior team, is with us for the first time, and although he's not a member of the board, we welcome you, and we welcome you to Merton, and we hope you'll have a long and happy career in the borough of Merton. So I think that's all. Are there any other apologies that we're aware of? Okay. Item 3 is declarations of pecuniary interest. Are there any declarations to be made? Good. Item 4 are the minutes of the previous meeting. Are they agreed? Okay, so in that case, I will sign them. That's done. And item 5 is activity Merton Borough of Sport. And I understand that Barry is online and he's going to introduce this report, and Dagmar may join in if she feels the need. But Barry, are you there? Yes, I can see.
Yes, good evening, Councillor. Good evening, everybody. Really pleased to be able to join you this evening to talk through Actively Merton. And I think that this is a really positive and it's a good partnership opportunity, both for the Health and Wellbeing Board and for our Merton Health and Care Together partnership. And the paper, although I'm going to present it to you this evening, is a joint paper between myself and Gemma Dawson, who is in the chamber with you this evening. And members, you may remember, cast your mind back to June, just a few months ago, where you received a paper on health in all policies. And if you remember, that health in all policies approach was to put health, equity and sustainability at the centre of all of our policies and decision making. And so our approach to delivering health in all policies was clearly to work through a series of exemplars. So we're presenting to you this evening the first of our exemplars, which is Actively Merton. And what this is going to do, we are going to work to increase the physical activity levels of our residents, increase the social activity levels of our residents, and we're going to deliver that in a way that our residents and our staff want it to take place. Clearly, you'll see in the paper really strong alignment and synergies with the Borough of Sport, which is one of LBM's corporate priorities too. So why physical activity and social activity? It's good, it's fun, it brings people together, but clearly both of those things are also very important to both our physical and our mental health. And section 3.2 of we prefer compared to
Barry,
to
you're freezing. We're getting about every third or fourth word. Can you just repeat the last bit?
Thank you, Councillor. Apologies. It's we within the paper. Hopefully you can. Let me turn my camera off. Hopefully you can still hear me.
Yes.
Thank you, Councillor. So you can see in 3.2 that the activity levels and the isolation levels, we perform pretty well when compared to London averages, but this masks two particular issues. The first of those is the scale of Merton residents who are inactive. Like I say, not significantly different from across London, but as one of our key public health risk factors, physical inactivity, there are 31,000 Merton adult residents that are inactive. So they're not taking part in 30 minutes of physical activity in a week. We also know that about 50% of the children and young people within Merton, again, not significantly different from the rest of London, are not active enough to benefit their health. So although we are green on those indicators, there's much more that we can and we want to do. The second issue is around when we look at the physical activity levels and isolation and social activity levels through an equity lens. And again, what we know about the physical activity levels, to take one example, is that older people, ethnic minority groups, women and girls, and those who are living in East Merton are less physically active. So they're not getting those benefits, both to their physical and mental health, but also the social side of things. So what this presents to us this evening, to the Health and Wellbeing Board, in a similar way to our previous work on tackling diabetes and child healthy weight within Merton, is to take joint action. So we're going to take action. So our proposal is threefold. First of all, to pull together a menu or directory of services that covers both physical activity and social activity, because there are lots of fabulous assets and services across Merton. When we think about physical activity, we've got AFC Wimbledon, we've got leisure centres, we've got some great parks and open spaces. Walk and Talk is another example which has been well received recently. And then when we think of the social activities that are available, we've got libraries as the front door to the prevention offer, adult education, our fabulous voluntary and community sector providers delivering lots of activity across Merton. And we also have that cultural offer, so whether that's choirs and singing and dancing as well. So we're going to pull together the menu and directory of services, but we're also going to look to add some high visible, some new programs to Merton to bring them into the borough. And I'll come back to that in a little while. The second part of the proposal with the directory is to build a movement. And what we want to do is to activate our networks to talk about physical activity and social activity, and then use that menu of activity so that our residents and our workforce are aware of how to participate. And you can imagine, and this is within our gift, we can train up those social workers in the borough, our youth workers, primary care colleagues, to be able to promote the activities that we have within the borough and those new high visible programs. The third part of that proposal is about comms and awareness. There are many, many benefits of both physical and social activity, so we can have some real fun to promote the activities that we've got within the borough. Clearly, underpinning the activities of Actively Merton is evaluation. So we're having ongoing conversations with external bodies to help us monitor the approach to Actively Merton, but also clearly those individual programs will have their own monitoring regimes as part of them. So to close up with some next steps, the report set out that we would work across Merton Health and Care together and our partnerships within Merton on a number of funding bids. And we have some good news. And the first bit is about we have successfully secured £65,000 from the ICB Inequalities pot. We've also been able to explore repurposing some of the funding that we have for Vaccination Plus to be able to deliver some of the comms and the menu directory of services. And thirdly, we've also managed to secure funding from across Sport England, within the council, and again from our ICB colleagues to start the first of our high impact and visible programs. So this is Beat the Streets. You will see this in the report. I know that you will have read that. But Beat the Street is an evidence-based intervention to get children and young people and their families more physically active through active travel, walking more, cycling more, scooting more, perhaps to school. And it gamifies, it's gamification of the environment. And evidence from elsewhere, because Sport England have delivered this in partnership across many places across England, what the evidence shows is that participants are more active after the game has finished. So it's a real good programme for us, and we can get behind it with lots of people within Merton taking part. We're going to work with our comms colleagues, both across the voluntary sector, within the borough and within the NHS colleagues. We'll work really closely with our primary school leaders who are doing some amazing work to encourage their children and young people to be active, to get as many people talking about physical activity, talking about social activity, all under that banner of Actively Merton. So final point from me, Councillor, is that we're still working to secure additional funding. We still want to create and benefit from those links from the Borough of Sport. We know we've got London Sport within the borough, helping us to work on our sport and physical activity work. And we're still keen to bring Live Longer Better, which is a physical activity programme for older adults to the borough as well. So as we move into this really exciting delivery stage, our Health and Wellbeing Board members' support will be absolutely critical for us. So I will probably close there, Councillor, and hand back to you.
Thank you, Barry. Dagmar or Gemma, do you want to add anything to what Barry has said before we open it up for questions?
Sorry. Yes, please. So thanks, Barry, and good evening, everybody. I just wanted to really point out that Actively Merton is meant to be as not a project that, you know, we start, we have a middle, and then it finishes again. It is meant to be a way of working and being. So we wanted to start it off with quite a big bang, with a launch and some visibility. But then there is really the ambition is, and that's where the term movement comes in, that we maintain and build it so that the norm in Merton will be enjoyable opportunities for physical and social activity increasing. And that's a slightly different way of thinking about prevention, because it is our approach to prevention, because as Barry said, physical activity and social activity are really remedies for a lot of the long-term conditions, mental and physical, that we see. So I really recommend the Health and Wellbeing Board fully supporting this approach. And once we launch in January with a directory, you are all champions and also eyes and ears on the ground to feed back so that we can really develop the program. Thank you.
Thing to add, Gemma?
Yeah, just to add that the Actively Merton is a pillar and part of the vehicle to deliver many of our priorities in the local health and care plan, and it's very much a partnership project with many partners coming together that are represented in our partnership group and in our Merton Health and Care Committee. So that's all I'll add.
Thank you. Are there any questions or comments? Mark.
Just to say thank you for the paper, and I think from a ICB Integrated Care Board Committee, we really want to support and get behind this, and this is one of the key areas that we've been talking about, and so therefore putting our money where our mouth is also really important. I think it is just a word of caution that we have to make sure that this is part of the Merton Sport borough of sport, so that it's not seen as something that stands alone. It is part and parcel of the whole kind of Merton strategy. And we talk about within it the kind of the funding around social isolation and also physical activity. It's really important. We've said this before at the Health and Wellbeing Board. We need to make sure the resources are in the voluntary sector to be able to cope with that support to people. Thanks.
Thank you. Jennifer.
Yes, thank you very much. They're very interesting to hear about the new initiative. Interesting what you just said there about the strategy for Merton. I'm just wondering, how does this link in with the London Sport work with officers, stakeholders to develop the sporting strategy? Will this actually be part of it, and how much of it is the independent evaluation being going to cost that the London Sport are doing?
Slightly, absolutely, and apologies if we haven't made it clearer. The attempt is very much a twin sort of program. Borough of Sport has obviously the focus on sport. Actively Merton is slightly wider in terms of physical and social activity. So really they can complement each other ideally. And that's what we're precisely trying to do. And as with Beat the Street, as Sport England is match funding our effort, that is an example of the really hand in glove approach to the Borough of Sport. And the public health team across the council works very closely with Adrian's people in the sports team, so that we are in a way pulling our energy in one direction.
And do you want to add anything?
But never mind, I'll speak loudly. Oh, great stuff. Yeah, the Borough Sport, as everyone knows, is one of the priorities of the council. We're currently working with Sport London on a strategy going ahead, whereby we want to tackle the inequalities that exist in terms of access and opportunity in the physical activity in sport, but also bring physical activity in sport as a solution to wider social inequalities. And we can only do that with the help of public health through education. Even in the libraries, we currently have a number of exercise routines going on. So it is a combined effort by a number of services. And Borough of Sport, in some ways, focuses the mind on sport, but actually it is about activity and movement. It is about getting as Barry referred to, the number of people who are inactive, getting them actually into some sort of regime of being active and actually getting healthier and fitter. And it's not just about, the sport element.
Any other questions? Brenda, sorry, I did see you earlier on.
Thank you, Chair. This is quite interesting, but I'm just wondering about young people, and I can't see anything to do with competitive sports. So does that mean that's not part of it?
Yeah.
Casa, yeah, I mean, we are focusing on 4 to 16-year-olds and over 60-year-olds, so that we're catering for both ends of the spectrum. We appreciate that generally those within the age band are more active anyway, but certainly we will be concentrating on the schools, age pupils and the older generation.
Si.
I really welcome this initiative. I mean, Dagmar knows that, and certainly in Merton there are significant inequalities around childhood obesity, for example, in the East of the Borough. So I think it is important to look and support our young people. The only other thing to highlight that is in primary care, we do have new roles that are supporting local people. We've got health and wellbeing coaches and social prescribers. So obviously any new issues that are coming out, please do let me know so that we can raise awareness of that when patients do sort of contact primary care services.
Jennifer?
Can I just mention a few things I'm concerned about? I think it's a fantastic initiative to get everybody out and active, but we do have to look at the facilities that we have and the difficulties that parents are facing with the cost of living crisis. And when I talk to parents and residents and look around my area, it's the maintenance of the facilities that is really lacking, and I'm hoping the council will be putting funds into that. Thank you.
Do you want to respond to that? Is that your...
I mean, currently we are obviously going through the capital budgeting process, and obviously we will consider all of the facilities, etc., through that process.
Well, Tuesdays is Grandad Day in our house, and it's when we take responsibility for looking after one or more of our 7 grandchildren. And today you'll be pleased to hear, Dagmar will certainly be pleased to hear, that I visited soft play at the Cannons, and my 14-month-old granddaughter was wandering around on all the equipment. It was very safe. She really enjoyed herself. At one point she picked up this cylinder shaped thing and was walking around a bit, and I thought, oh, she's impressive that she can carry that, and she's only not long walking. So I think we should encourage that. But coming back to the point that was made earlier on, it struck me that there will be families who might want to use that facility in the future and simply can't afford to, with all the things that are going on in society at the moment. And well, for much of the time we were there was nobody there. And I think we should be thinking to ourselves, isn't it better to open that up in order to address the issue of obesity in children, get them active early? It seems to me a very good strategy. So perhaps we could think about that as we go forward. Any more questions? Okay, the recommendations are on page 5 of your agenda, A, B and C. Can we agree those recommendations? Agreed, thank you. Okay, so item 6 is health on the high street, and that's Mark and Gemma, who's going to kick off? Mark, you've drawn the short straw, have you? Over to you.
Cool. Hi, thanks everyone. So my name's Mark Connor. For those of you who don't know me, but I know lots of people in the room do. So I'm a project manager with Merton Health and Care Together, working with Gemma. And then I'm just going to talk today about one of the projects I've been working on, which really is a collective of lots of mini projects called Health on High Street, which I know lots of people have been asking about. But it's really exciting. We're kind of moving to this next stage of starting to deliver some things. So there's lots to update you on. So let's go to the next slide. There's only a few slides today, so don't worry about that too much. So this is a bit of context just about what the project actually is. So the background to what Health on High Street is, for people that don't know, is I believe the initial concept was where you could go to shopping centres and get your COVID vaccination at the same time. So then they kind of realised this is a really smart approach to engaging with people while they're out and about. It saves people time. So could we look at exploring moving those into kind of other areas of health and wellbeing? So this project's kind of got started in April, and to start with, kind of brought some people together from within Merton to agree kind of 4 main principles that we wanted to, when we were thinking about funding some smaller scale projects in the community. If they met these requirements, then we could kind of go ahead and get delivering. So it says there on the slide, but the main one's about looking at existing services and changing the way they are delivered, and really focusing on what's working well in the borough and trying to lift those up and champion those. Looking to strengthen local communities, which came about as in a post-COVID world, people feeling less connected. Also being locally owned, so not prescribing to people how they should access healthcare, but really trying to bring people along on the journey, finding out from communities in Merton, what would you like or what's been missing? And then also, clue is in the name, as focusing really on the high street and these communities in Merton where people actually get together and spend time. And just to highlight as well, Health on High Street is like a key project in the local health and care plan. So it's great to have Merton Health and Care Together kind of helping to push that forward. So on the next slide is so there's lots has gone into this, which isn't on this slide, but this is kind of the current portfolio of things that we're looking at and exploring. And what's quite exciting is now that we've actually been able to put some budget to some of these projects. So I'm feeling more confident about them getting off the ground. So I won't talk about all of them in heaps of detail, but some of the really exciting ones. So in Merton, as most will know, we've got Start Well, Live Well, Age Well as kind of these age brackets that we work in. So for Start Well, focusing on young people, we submitted a bid to the South West London Innovation Fund to get some funding to deliver a young people's wellbeing hub, which the idea behind that would be a space for young people to kind of get together, to spend some time outside of school or just kind of in the community, separate from youth centres, which then eventually we could kind of get feedback from them about what would they like, what's missing. Do they need more mental health support outside of school? Do they need more vocational support? And then work with them to kind of eventually start to deliver these in a specific space dedicated to them. So we've not heard back from the Health Innovation Fund yet, but in case we don't get the money, we've got some put some funding together, I think, to deliver a smaller scale version of that. So that will hopefully be happening in the new year, and we're talking with the libraries about potentially as a good place on the high street to run those. One from Live Well that we're quite excited about at the moment is been working with Merton Plus, which is the LGBT forum in Merton, about trying to get that back up off the ground. And that's one of the big focuses of the project, is to look at health inequalities, which I think is what everybody's trying to do. But one thing that I noticed when I was kind of researching Merton, as I was quite new to the borough, is there was it's kind of, oh, maybe we need to do a bit more for LGBT people, because it didn't seem to be much specific to that community. And then I'm from that community, so it was important to me as well. But been working with Merton Plus, so in February will be LGBT History Month. So we thought that would be a really good time to look at doing some things across the borough to kind of get the community together, with the view that we could eventually start to have a bit more of a voice which could inform the commissioning of future services. So some of the things that we're looking at is working with Sustainable Merton to do like a repotting of houseplants, because it's about the right time of year, and it's just kind of fun things that people might want to come to, and they can potentially meet new people, and then also just re-establish them as a presence in the borough, and then eventually to like a Merton Pride in the summer. We're also thinking about like an LGBT film night, some coffee mornings, copying what's worked really well in Wandsworth. We thought, why couldn't we bring that to Merton? So watch the space for that. So we're still trying to organise some of those. And then in Agewell, one of the things that currently being delivered, which is quite successful and is a bit further on in slide 2, is working with the Alzheimer's Society to deliver some dementia drop-in coffee mornings. Actually, they're in the afternoon, but one happens in Metronome, which is across from the Civic Centre on Tuesday, so it happens today. And then the idea being there is that it's a small amount of money that we've put where the team from the Alzheimer's Society will be there to answer questions any members of the public might have. They can get a free cup of coffee from them too. And then the idea was it started very small. So the first couple of weeks, we didn't really get many people engaging, but it started to spread by word of mouth. And then we're also looking to get them into other cafes. It could just be quite hard to get people to respond to me, but we're still working on that. So I'll go on to the next slide now. I think there's a bit more info about the dementia drop-ins. So here's just some like pictures that I took from one of the events, and then some posters. You can kind of see from the tweets, it's starting to get a bit more, people are starting to notice it more in the borough, which is really exciting. And from feedback from the Alzheimer's Society is it has grown. And I've had hoped to kind of get some of the feedback with some of the actual information they've been collecting about the number of people they've seen, but I've not managed to get it in time. But they've already, I think, reached about 8 to 10 new people, which doesn't sound very much, but these are people with recent dementia diagnoses that the society didn't know. And they were able to follow up with them and go do some home visits and get to know them and offer the support to the families. And the guys at Metronome have been really, really, really supportive of that. So if you're available on Tuesday, please feel free to go there. The team are really, really friendly there. And then the reason why it's in Morden is the society noticed that was kind of a spot in the borough where they didn't have much reach because they're currently based in Mitcham. So we've been using that to approach other venues around the borough as well to see if they'd want to host us. And what we're really excited about as well, because this model seems to have already been quite successful. So we're trying to think, how could we apply that to other services too? So I mentioned with the LGBT morning that they have in Wandsworth, if we could do that in Merton for members of that community to get together, and we could get mental health support workers to come and talk to people there as well. That's one of the things we're looking at. And then the next slide. So this one won't talk too much about, but it was just to mention that we are thinking of how we're going to evaluate the project in an ongoing way. So what I've written here is just one of these it's kind of a framework which we worked with Health Improvement Network to develop, but was just to say we could put the funding that we've put towards starting the project for these dementia drop-ins, we could kind of fill in all of these boxes, and it will kind of already answer for ourselves whether or not it was a success. So this is in draft, and that initiative is still ongoing, but it's something that we can apply to all of the other constituent projects as the project moves forward. And then the next slide is just really to show what's next. There's not much else after this, but coming up, we've been working in Mitcham, and I've been trying to get to know different people, because one of the things with this project that I realized pretty fast was you really need to build trust with the different communities to want to work with you. So what I'm particularly excited about working with the South Mitcham Community Association is we kind of I went to meet with them, and we were talking about what goes on at the centre and if there was any things that they had wanted to do but they might not have had the funding for. So at the top, working with Fulham Football Club, this was before COVID. They were in discussions with the centre to run some like sports related activities for men in particular, who they kind of noticed weren't coming to the centre. But then because of the pandemic, just nothing kind of really happened. So we're working with the FFC again to see if they would be able to start running those. And then I think that's really great, because this is something the centre specifically said that they wanted, and that people from that attended the centre or from that community in Phipsbridge would really benefit for. And then so we've got 2 dates for some health and wellbeing days, one also at the SMCA, and then another at the Lantern Arts Centre in Rains Park, which will be on the 21st of January and the 7th of February. And there it's going to be a collective of different organisations that are working in Merton, and we've had some really fab interest of people that want to attend. So now it's just moving on to that stage of organising the logistics of who's going to be coming. But it will be, the idea being that it will be in the winter when people might not want to go outside, but giving them a reason to come and engage with their community again. There'll be hot food, and then there'll be lots of health and wellbeing services that people can get information from. We've also got some teams from St George's who will be able to do on-site screening for different kind of cancers, liver disease, and will be available to kind of answer any questions. So that's really exciting. And then we've also been had some costing from Wimbledon Guild about running workshops, and there's quite a few different ones that they can do. But one that we quite like look of would be some assertiveness and boundaries workshops, which was based on feedback they had with people that engage with their services in Mitcham, targeting women. And then they'll be able to do those in person. So kind of bringing people together, helping people have more confidence to live their lives. Yes, and I think that was it really. So it was a bit of a whistle-stop tour of what we've been working on, but as I said, it's quite exciting that now things are actually starting to turn into delivery versus a lot of the scoping. But it was really important that we did that before, rather than jumping straight in and delivering something that people didn't want, especially when we're using the funding to do it. But happy to answer any questions. And if you don't have any now, my email's on the first slide, and I love talking about it. And I'm really passionate about trying to make it work. So please do drop me a line if you have any questions or know of any other people that I should connect with.
Gemma, do you want to add anything?
Nothing immediately, no.
Okay, thank you, Mark. Are there any questions on this item? Brenda and Bo, I've got, and Jennifer. So
sound very interesting and exciting. Have you been to Palazzo?
Yes.
Did you see the map on the wall at the bus stop?
Yeah.
Oh, great. Because that was just an old derelict place.
Yeah.
And now you can see how they're relating to the public. And so I was just thinking, if you haven't, that's something we can copy for other places.
Yeah.
Yes. And the next thing is, I didn't hear about the charities. Like you said, Wimbledon Guild, but what about AGK? Have you been to see them?
Yeah, so that was one of the, so I hadn't worked in the borough before. I'd worked in South West London. So one of the things that I really wanted to do was to get to know kind of everybody. So basically anybody that would talk to me, I would happily go and meet. So I go into the borough quite a lot, but yeah, AGK, Wimbledon Guild, Myrtle Vision, Alzheimer's Society, been talking to Spectra, Free to Be, which is a charity that supports young LGBT people, which they do some really fab work in some of the schools in Merton. So yeah, always trying to reach out to new people and go to as many different events in the borough too, so I can kind of make my face more well known, so people want to talk to me. Yeah.
Oh.
Thank you, Mark. I was just wondering, in terms of the Red Telephone Box Youth Mental Health Project, how you're linking in with the peer education program, which is also doing a lot of work around young people's mental health.
So is that, so the peer education program, is that with the mental health teams in schools?
No, I believe it's a program run by that has been developed by London Borough of Merton's Youth Service, and they have 35 peer educators. So that's young people aged 16 to 30 who are working specifically on a campaign around self-help and signposting for young people who are experiencing mental health issues. It just seems that a lot of things happen in isolation, and a little bit more joined up thinking may help to engage a wider audience and maybe save costs as well.
Yeah, absolutely great. That would be, if you could link me in, because that'd be really helpful. I've not heard of that. And I think that's definitely what this project's helped to uncover, is actually how much stuff happens in isolation, and part of Health on High Street really has been to kind of link or make as many connections with different people as possible. And I mean, with the 4 kind of bullet points on the first slide about what we wanted to make sure our projects would deliver, I think everybody, any kind of community service or really any service at all, is going to be delivering those. They're not anything new. So yeah, it'd be really great if you could connect me with those, because I'd love to do that. And I think one of the things that this project's been really great at doing is kind of revealing other services that maybe nobody really knew about at all. So with the dementia cafes, for example, at Metronome on the last Thursday of the month, they have a counsellor who comes in and runs, and their sessions are called Space Talk, and it's literally anybody can just go in and they can just chat to this counsellor about any issues that they're having, and they were struggling to get people to come because not many people knew about it. So we've now our comms and engagement team actually advertise that every month for them, and they're now looking to expand. So being able to link into those different kind of groups has been really, really important. So if you wouldn't mind, Bo, that would be really helpful.
Do you want to add anything?
Just wanted to respond about the peer educator program, because we are very involved, and I can absolutely link you up. And I think both the Actively Merton and now the Health on the High Streets are attempts to connecting the right services with the right people, and both very much acknowledge that we have lots, but sometimes it is the hardest bit to connect the right people to the right services. And it wouldn't for one moment claim that I have the recipe up my sleeve how to go about it, but both are attempts to help that process, because absolutely using what we've got, we have a tendency to add on, and so better use of what we've got and promoting and connecting is what we both programs try to do, and every help is welcome. So having an open dialogue, and I will connect you up.
I mean, this sounds like a really great project, and I think Mark's engaging approach could start off another social movement in Merton, which I think would be welcome. But I think anything that embeds prevention and self-reliance in communities is really positive. You're welcome to come and meet our PCN clinical directors. It's worth highlighting that Merton Health have done a huge amount of community outreach through the vaccination programme. We have around 40 sites across the borough, so it's worth also connecting with the Merton Health vaccination team as well. Community services also have a transformation board, and Mark, you're welcome to come to that as well and meet all the community services that are being delivered across Merton, all the leads for that. They probably would also be very interested in your project as well.
Thank you, Si, for that very positive response. I mean, Mark said that he'll speak to anyone that will listen to him. It looks like we're going to be filling up his diary well into the new year, but that's to the good. Mark.
Just to endorse, really, I think this is really quite exciting. And when we're talking about inequalities, I think that there was a real theme through there that targeting geographic areas, targeting communities and targeting individuals. I wouldn't worry too much if you only reach 8 people, because sometimes you have to get right down to the 8 people that need the help. And I do think actually this is not just a health initiative, it's a joint initiative. And actually we do just need to make sure that we're linking it up so that actually we're getting that, we're sweating you as an asset and these assets as much as we possibly can.
John.
I just wanted to thank Mark and Gemma and the team for all the work they're doing. And I wanted to just echo, I was going to say something similar as well. I think it's really impressive that 8 people that were just diagnosed with dementia are now linked into services, them and their family to support. I think that 8 people is really impressive for a start. And I think that this is really exciting. Health in the High Street isn't about a replacement for GP services and traditional health services. It is about embedding prevention into our communities. And I think that's really, really exciting. Also, it's exciting it is joint between Public Health Council and the NHS, but it also fits very well into the Council's priorities around civic pride and about sustainability, about revitalising our high streets, with these things popping up across the borough and making our high streets much more exciting places to be on. And that's all I had.
Thank you, John. I was pleased to see that you are developing an evaluation framework, because you know, I call me cynical, maybe I'm old, but I like to see some evidence that public funds have been good use and that there is some outcomes that we can measure and demonstrate value for money. So I'm really pleased with that aspect of it. Please don't neglect that with all the conversations that you're having, because I'd like to see you coming back and telling us the results of that evaluation. I hope there'll be very positive things to share with us in the future. Any more questions? Jennifer.
I think I'd just like to endorse what everyone else has been saying, and great to see your enthusiasm for the project. And also I was going to say exactly the same thing as McCabe about the evaluation. It's a super idea as well. Just to say, have you connected with, I'm sure you have, religious groups, ethnic minorities, Mertonsville, I'm sure you've had a great, yeah, and it's great to see the Dementia Cafe have a relative who's suffered from that, and I'm sure I would come along if it would have been open. One other point though is accessibility. It's not always easy for people to access, to get public transport, again with the cost and everything. So keep that in mind about accessibility. And I just a question actually. You had the dial-a-ride. Is that available for people with dementia to take to use that service with carers? I don't know. Just a thought as well.
Yeah, not sure about dial-a-ride, but I'll definitely look into that because that's a good point. So with the cafes, we just advertised it widely online, and then I just went into Morden and was like, anywhere that would let me put up a poster, we just put them up around the place. So there's actually one downstairs in the building to try and get the word out in as many different ways, because accessibility about being able to get there, but also to find out about, especially for people with dementia often older who might not with online as much. So but I'll find out about that. Right, that's a good point. Thank you.
Okay, thank you very much for the presentation, which is noted, and we can now move on to item 7, and we're going to, I mean, there are various parts of this, but Keith is going to present his report, and I'm aware from the conversation that we had not very long ago that this was dependent on, to some extent, the announcement made by central government, and there was a kind of plan A and plan B depending on what they ended up doing. And I think what that demonstrates is that to be at the top of the adult social care team, you need to be nimble and quick on your feet. So pleased to see this report is here, and please go ahead and present it, please.
Thank you, Chair. So I will just start by explaining that there is, as you say, there's a slightly unusual element to this report, in the sense that it was drafted before the autumn statement, and it was drafted in relation to a number of reforms that in the main were due to come into effect in October next year. So we intended bringing them information about those reforms to the board roughly a year before implementation, just under a year before implementation. As part of the autumn statement, the Chancellor announced that those reforms, particularly relating to the charging regime for adult social care, were being delayed for 2 years, so are not now due to come into effect until October 2025. But rather than withdraw the paper, we thought, actually, yes, there's the plan B was amend it to reflect that changed timescale and bring it for information. So what I would suggest is, while I'm happy to answer questions about the charging reform elements of the paper, I think in the main, those elements are for noting at the moment, given that over the next 3 years before the reforms come into effect, it's highly likely that there will be changes to the way in which those reforms come into effect. So I say happy to answer questions on those, but there's probably little value in paying too much attention to that element of the paper at this stage. What is much more relevant and contemporary, if you like, is the section of the paper that deals with Care Quality Commission assurance, which was another key plank of the social care reforms announced by the government at the end of last year. And this brings and so this is the section of the paper from paragraph 314 onwards. And this brings back for local authorities external oversight and regulation effectively of our adult social care functions. So the care quality, well, predecessor bodies to the Care Quality Commission used to inspect and have regulatory oversight of local authority adult social care functions. That came to an end in 2010. So it in effect is being reintroduced and is still scheduled to come into effect from April 2023. And I'll talk in a second about the main elements of that assurance framework, and I'll talk a little bit about the linked assurance framework for integrated care boards. But just to talk a little bit about the timescale and the way in which the new assurance regime will be implemented in the first instance. So as I say, it's due to come into effect from April next year. Clearly, well, for it to come into effect, there are regulations that have to be passed, and the Secretary of State has to sign off, and the Secretary of State for Health has to sign off on those regulations. That hasn't happened as yet. There have been a series of changes in Department of Health and Social Care in terms of ministerial responsibility. And I think it's the signing off of the regulations that just got caught up in those changes. So although the intention remains that the assurance framework will come into effect next April, the necessary sign off from the Department of Health and Social Care hasn't happened as yet. We're assuming it will happen, and we're assuming it will go ahead in April, but I just wanted to be clear that actually there's no formal confirmation of that as yet. What that also means is, while we know in broad terms what the assurance framework will cover, we don't have certainty at this stage about the detail of that. And again, because that's linked to ministerial sign-off. So while we are preparing for the reform for the assurance framework to come into effect, until we get the detail, and that may well be quite close to April, we can't completely prepare for the new regime coming into effect. But we can manage that, and we will manage that. So in terms of the assurance framework itself, as the paper explains in paragraph 316, it's built around 4 key themes. And those 4 key themes, the first of those is working with people. So that's all of our day-to-day adult social care activity. That's assessments, that's reviews, care planning, our work with individuals. But it's also about how we support individuals to live healthier lives, how we undertake prevention activity, how we provide information and advice. So there's a broader scope there, which is very relevant to the Health and Wellbeing Board, I think. The second of the key themes is called providing support, but it's not about providing support to individuals. It's about providing support to the social care market. It's about providing support to the social care workforce, and particularly the external workforce. And it's also about integration and partnership working. So again, lots of relevance to the wider health and social care system and to the work of this board. The third key theme is called ensuring safety. So that very clearly is about, at an individual level, how effective we are in our safeguarding responsibilities in relation to individuals, how well we are, how good we are at preventing harm and keeping people safe. But that theme is also about safeguarding at a systemic level, at a system level. So how safe are our systems? How safe are our discharge pathways, for example? How safe are we in terms of managing continuity of care, particularly where people are moving between sectors? So for example, between health and social care. So again, very importantly about individuals, but equally will be looking and focusing on systems and how effective those systems are in terms of safety. And then the final of the 4 key themes, leadership and workforce. So that is about obviously officer leadership, but it's also about political leadership, it's about system leadership, and it's about how well we are strategically planning for the future in terms of kind of managing future demand and so on. How good we are in, well, what are we doing in terms of innovation, thinking through how we might manage social care differently in the future, and also how effective are our governance arrangements in relation to our adult social care functions. So those are the 4 key themes, and they're unlikely to change in any material way before the framework comes into effect in April. Sitting below each of those 4 key themes are a whole series of what are described as we statements and I statements. And the we statements are effectively what good local authorities should be able to say about how well they are delivering adult social care. We provide timely and effective assessments for adults who are referred to us, those kinds of statements. And they're intended to provide a kind of benchmark so CQC can say, do we have evidence that you consistently meet that we statement, or are you exceeding it, or are you falling below it? And that will help in terms of how they gauge our performance on an ongoing basis. And alongside those we statements, there are a series of I statements, and those I statements are intended to reflect people's experience of the social care system. So people's experience of going through the assessment process, receiving care from whatever home care, residential care, whatever it might be. And again, they're intended to provide a benchmark against which the CQC can judge how well we are delivering care from a citizen, from a resident perspective. In terms of how the framework will operate, so a key element of that will be an annual self-assessment, which we will be required to complete on an annual basis, as it says, and that mirrors part of what previously was the arrangement up until 2010, and that will be submitted to CQC, and they will then look at what evidence they have that what we are saying in our annual self-assessment matches with what they know about us. There will be inspection type activity, so similar to Ofsted and other kind of inspection arrangements. What appears to be the situation at the moment is that that's less likely to be big set piece inspection events, and it's more likely to be more focused, perhaps on site for a small number of days, but quite a lot of work done remotely. So, for example, focus groups with customers, focus groups with residents, focus groups with groups of staff and so on, that might be done remotely rather than physically on site. But certainly inspection type activities will be a key part of the framework. And underpinning a lot of that will be the lived experience of people who are using services and their carers, their informal family carers. And CQC will be gathering that evidence directly from customers. So we do annual surveys, we do a range of other things. So CQC will use evidence from those kind of direct surveys. But they will also ask us, how do we gather information about about how people experience the services they're receiving, and what do we do about that? So there'll be it's really important that we're able to demonstrate how we ask people about the quality of care that they're receiving and what we do when we hear that things aren't going so well. So our complaints reports, our responses to when things go wrong, our responses to safeguarding issues and so on, all of those factors will be important elements of the evidence that we're able to provide. Alongside that, there will be a sector-led improvement offer. So that's local authorities working together to learn from each other, to look at how we can improve. And there's a well-established peer review process across London. So all of the London boroughs put together groups of staff who go in and look at how individual boroughs are performing in a critical friend kind of a way. So it's helpful in terms of getting an external perspective on what we're doing well, what we might be not doing so well, and where we might need to improve. But also it's a really important learning tool for the borough that's being peer reviewed, but also for the peer review team in terms of the experience of seeing what other boroughs are doing and taking that back to your own borough to learn from. So that's the main elements of the CQC assurance framework. The one last bit to say about that is that it is very likely, but not confirmed, that there will be a rating applied to each local authority, and that will be reviewed annually. And those ratings, although we don't have we don't yet know exactly how they will be defined, it's likely that it will be a similar model to the model that exists for providers currently. So probably a 4-tier rating, and for providers it's inadequate, requires improvement, good, and outstanding. So it's likely to be something similar to that. And for each of the 4 key themes I referred to earlier, they will be individually rated, and then those individual ratings will be summed to create an overall rating, and there'll be a kind of formula for doing that. That's not confirmed yet, but we think it's pretty likely that it will happen, and we expect the first rating to be probably around the end of 23-24. But again, no confirmation of that. So I think in finishing, just to kind of flag that alongside that, CQC are also being given the same assurance role in relation to ICB's integrated care boards. I think it's fair to say that the framework in relation to integrated care boards is less well developed at this stage. I think there's some more complexity around that. And there has always been an intention that there be a connection between the 2 assurance frameworks, so that over time, people could begin to get a sense of how well the health and social care system in a particular area is performing. And particularly, I think, how that will work in terms of that overlap and that interplay is causing CQC quite a significant degree of difficulty in terms of making that real. And I think we've been raising questions around that in London, particularly given the makeup of integrated care boards and boroughs, and the fact that you've got multiple boroughs within a single integrated care board footprint, and how you do that practically, I think, is going to be quite complicated. So there is probably a future paper to bring on that and on the interplay between the 2 assurance frameworks, but it's a bit early to do that given the lack of clarity around how that will work in practice. Thank you, Chair.
Thank you, Keith. Are there any questions? I mean, the obvious comment from me is, while they're waiting to get this sign off, is there any possibility that we'll be hearing what they're going to be looking at as they're walking in the door? So will they give us a bit more notice than that?
So we will get notice of inspection activity. They describe the first 2 years, so 23-24 and 24-25, as a baselining period. So over those 2 years, what they're talking about is getting an understanding of each local authority's strengths and weaknesses. So we're not clear yet what that means in terms of actual inspection activity. We think they'll do some, but I think it's highly unlikely that on the 1st of April, they'll be turning up at any local authority's front door and saying, we'd like to come and inspect you now, please, because we know they're just not going to be ready. So it will be some way into 23-24 before there's any meaningful inspection type activity, I think. But yes, there is a commitment to make sure that local authorities have a reasonable period of advance notice of inspection activity.
Are there any questions? Mark?
less a question, just more a comment. I think probably it will be really interesting to see the ICB framework alongside the adult social care framework. And as partners, we should really plan to do it together. And we know from our SEND experience, when we do it alone, we don't get a good result. But actually, the recent revisit where our partnership was really strong, we got a really good result. So I think there's something about Keith, John, as offering up, you know, the partnership to plan how we're going to cope with the framework going forward.
Well, I'm sure that offer will be much appreciated. Brenda.
Thank you. I thought that was quite good, seeing that children's services have just been through, just like Mark has just said. So we can learn from each other. And I was going to ask about benchmarking with other boroughs, but that's mentioned. What I really want to know about is the 4 themes: leadership and workforce. What exactly do we mean by culture, and how broad is it?
Keith?
Thank you. So that question, I think, is about when they use culture, they're using it in the sense of the organizational culture, the managerial culture, the leadership culture in an organization.
To me, that is quite narrow, because I know about organizational culture, but we were talking about BME and all sorts of things. So I'm sure that, well, I feel when CQC comes, or whoever comes, they'll be looking much more than that. Are we just insular or not? Are we thinking widely about the borough and who looks after whom? And that's why I'm thinking that culture means a lot more than that, but I might be wrong.
So absolutely, all of those issues about equity, about providing appropriate and responsive services to all of our communities will underpin all 4 key themes. And a lot of the we and I statements are about equity of access, about sensitive appropriate services and so on. And so absolutely that will be a key part of the framework, and it's really important that we're ready for that we're able to respond positively to that. And there are lots of ways in which we can do that.
Any other questions? Jennifer?
Yeah, obviously, with the implementation of the work that you've carried out already, there must have been a lot of many staff involved. I'm just wondering what they're doing now, or what they're moving on to, or how many staff were involved in all of that work.
Thank you. So that is a good question. In terms of the charging reform, we were primarily managing that within existing resources. So most of the staff who've been involved in preparing for that were doing it in addition to their day job, if you like. There may be some capacity freed up, but we've got a long list of other projects that we'll be assigning that capacity to.
Can I just ask one more question on 3.21 about the amount for funding amounted to 505,000? I'm just wondering if any of these figures now affect the budget for next year.
So, yeah, in terms of 3.21, so 321, this was some funding that was made available this year in relation to fair cost of care, and that's all been allocated for this year. 25% of that was used for implementation funding, so we did bring in some additional resource on an interim basis. And the remainder of that is going out to our care providers as one-off payments to support them with cost of living pressures and so on this year. that funding will be repeated next year, but it's within the wider pot that has been announced in relation to social care. So it's all now for future years. It's all now wrapped up in that additional funding of we'll call it additional funding that was announced as part of the autumn statement. And we haven't yet had the detail on on what the conditions in relation to that money and so on will be. So that once we get that, hopefully as part of the local government settlement announcement towards nearer Christmas, we'll be able to make more definite plans about how that funding is used. But it is that 505k is all wrapped up in that for future years.
Any other questions? No, well, in that case, we have recommendations on page 13. Are those agreed? Thank you. So the second item under item 7 is second part is the Integrated Care Partnership Innovation Investment Fund and Inequalities Investment Fund. Mark.
So I'll introduce it and then hand across to Gemma, if that's okay, Chair. Just to say that about a month ago now, we went through a process where there was money identified across Southwest London in 2 pots. One was the Innovation Fund, which was 4.9 million across the whole of Southwest London, and then the inequalities pot, which was a kind of ring-fenced amount for each borough to kind of bid against, and the Merton figure there was 342,000. So across all our partners, people were feverishly pitching bids in. I think with the Inequalities Fund, because we had that pot of money to bid against, we had sort of more kind of control really in terms of place putting the bids in. For the Innovation Fund, I suppose what I just want to say before I hand across to Gemma is that we do need to manage expectations there as well, because although there's 4.9 million available, they received in the region of 30 million pounds worth of bids. So actually there will be a lot of those bids which are not successful. And what we want to do at Place is not lose that kind of momentum and that enthusiasm. So we do want to take the unsuccessful bids into our committee structure to kind of look at them as if whether there can be alternative routes of funding if the committee supports them. But on that, I'll hand across to Gemma, who will give you more of the detail.
Thanks, Mark. Yes, so as Mark outlined, in early October, Southwest London launched 2 investment funds. They ran concurrently at the same time frames, but they were slightly different and used different paperwork and had different focuses. So the innovation funds, as Mark outlined, was a sort of applications were open for all partners, voluntary community sector, NHS, local authority, and any collaborations. The focus of the innovation funds really was that they wanted to have bids that expressed kind of new or novel ideas, particularly to focus helping building resilience across health and social care over the winter period. So funding is available non-recurrently, and ideally projects needed to be delivered within this financial year to help this winter. The Inequalities Fund, again, as Mark outlined, we had a specific allocation pot. So they used a needs-based analysis to work out how much each place, so effectively each borough in Southwest London would have of the funding. So for Merton, that was £342,043, and they were looking for expressions of interest that helped address some of the known health inequalities, particularly looking at the Core 20 analysis. And the Inequalities Fund, our kind of partnership across Place had a big role. We were asked to help coordinate and endorse the bids. So to make an application to the Inequalities Fund, the Place Committee had to endorse your bid and lend the signature to it. Could switch to the next slide, please. So here I've just got a summary of the bids that were known to us that were applied to the Innovation Fund from Merton. So as you can see, we did put together 11 bids from a range of partners, grossing around 1.4 million. So we're still not sure of the outcome of these bids, as the panel is still deliberating, and so we'll let anybody know as soon as we find out about the outcome. But I think it's worth seeing the sort of scope of innovation that came through from the borough and from all our partners. Also to see the level of collaboration of most of the bids were multiple partners coming together, working together. And there was also strong alignment between some of our existing priorities and projects in our local health and care plan. So you'll recognise in here Health on the High Street, Actively Merton, some of the and expansions of existing projects that are already inside our local health and care plan. We go to the next slide. So here's a bit of analysis on our inequalities bids. So we had a potential of 22 projects. So again, the scale of innovation, and the response from all of our partners across Merton was absolutely fantastic, particularly given the short timeframes and the notice period that everyone had here. So the vast amount of ideas and projects that people came together to pull together was quite incredible. Out of the 22, the Place Committee, who had a key role in endorsing the projects, kind of came up with a short list of 11. The majority of them were from the voluntary sector. And the feedback that we received from the Health Inequalities panel was that Merton's bids were of high quality. So there wasn't really any further questions or follow-up, lots of detail, really evidence-based. So I think that's, again, credit to all the colleagues and partners across Merton. And as Barry already mentioned earlier in Actively Merton, we do know the outcome of this now, and all successful bidders have been told. So if you switch to the next slide, we can now confirm that all 11 of these projects have been awarded the sums of money, so we'll be moving into implementation. Again, I think you'll recognise some of these projects. You can again see that there's very few that are individual organisations. Most of them are collaborations and people joining up, working together. Also, there's huge overlap with our priorities and projects that we have in our local health and care plan. So lots of ideas to tackle inequalities that line with our existing projects. So we're, as I say, all of these have been successful, and we're just waiting now to kind of work through the practical elements of getting the funding across and working through what the monitoring and get implementing. If you could switch to the next slide. And then just lastly, we're quite keen to kind of really build in all of the projects, regardless of whether they were successful or not, into our Merton health and care plans, to make sure that we retain all of those ideas, pursue them through our own routes, and look at how we can try to explore them and develop them so that no ideas are lost. And we're also really interested in how we can try and tap into more proactively that innovation and creativity that's clearly there, so that we can make sure that we can make a mechanism for ourselves to capture these ideas, so that we're really ready and prepared for any other future opportunities. We know that it's likely that they might repeat some of the South West London investment funds, but the process might be different. So we're keen to feed back some of the learning, some of the barriers or ways that it could be more accessible, so that the process can be improved. And most importantly, we're really focused on making sure that we can support those who've been successful, so that they can deliver and get going with their ideas and get that change on the ground, and also so that we can support them in measuring the impact in a kind of sort of smart and lean way, so that we can make sure that we understand the impact that it's had and can look to scale any of those fantastic ideas. So I'll leave it there.
Thank you, and thank you for the up to the minute report of what must have been a great deal of work in a very short period of time. A great deal of work for those submitting the bids, but also a great deal of work for those scrutinising the bids and making decisions about the public money concerned. So are there any questions? Mark, do you want to ask a question about
I'm not asking you a question. I'm just going to add a couple of comments. We are anticipating that both funds are available next year as well. So what we want to do is in January, we want to start that planning process for next year across the partners so that everyone's kind of got their thinking caps on, and those that aren't successful, we might take forward into next year. And then just since the writing of this document, we've also been made aware of the £500 million nationally for discharge. And I know that John and colleagues are working hard in terms of the local authority allocation on that. But we also do want to make sure that we are reviewing what we've funded through the innovation and the inequalities to make sure that we are maximizing the kind of the discharge funding as well. So there's a link to all these different pots of money.
Thank you. Any other questions or comments? Si?
Just one comment. I was one of the bidders, but I think Gemma's closing comments about how we harness innovation in the borough is quite important. And there's lots of good examples of that, both locally and nationally, of having sort of multi-sector innovation labs where people know they can send their ideas, and it almost functions as a dragon's den, where you have your dragons in the lab that sort of look at the ideas and then feed up into, you know, the Merton Health and Care together. So we may want to consider something like that as a way of harnessing good ideas, collecting them, and then acting on them. You know, if this is going to be recurrent funding.
That's a very important point. Any other comments? One of the things that we've been involved in discussing is the, you know, that this was very last minute, and it must have put real strain, particularly on small voluntary organisations that were trying to respond. And I think there's a desire that this should not be the case going forward. And, you know, we had to do it this year because it had to be done. But next year we can plan a bit more. And I think I'd like to feel that this committee would support the idea of decisions being taken locally in the future and at a more leisurely pace. Is that something that we can agree with? Do you want to add anything to that, Mark?
Yeah, no, I think we'll just feed that back into kind of the Southwest London ICB. And absolutely, I think we support that as well, is that hence the planning from January onwards, but also that we've got early indication of the funds that are coming to us so that we can plan appropriately.
John?
Just one other little point, and it's for Mark as well. I mean, the innovation fund wasn't shared on a borough-wide basis, and it would also be handy if that happened the next time, because the first fund for the 320 made it slightly easier because each borough knew what they were going to get for the inequality fund. The other fund was slightly more complicated, so we bid 1.2 million for a fund of 4.9. And from that fund, a little bit had been taken off already for other projects. So it was even a smaller amount. And it just made the process more complicated. If we'd had our fair share by borough, and then the place was able to work it out, and it needs to be learning from all the other boroughs as well, because you want to actually learn what happens and what a project that happened in Wandsworth that went really well in Kingston. You need that process. So the panel process was really good, which I was on actually. But the allocation, it would have been easier, I think, if it had been shared by a borough on a fair level as the Inequalities Fund.
So just to say that part of the Merton feedback that we are giving is that just that, exactly that we would like to have a ring-fenced amount for the Borough of Merton on the next Innovation Fund.
Okay, are we done on that one? Thank you, Mark. So that brings us on to item, oh no, it's C, different item, and it's Gemma, and we're talking about the Mayor of London's health inequalities tests.
Yeah. I've got some slides. Oh yeah, just got a few slides just doing a little bit of an update on some recent changes to the Mayor of London's 6 tests. So the Mayor of London's 6 tests were introduced in 2017, and they're really about challenging the NHS around any major changes, particularly reconfigurations, or to make sure that their statutory consultation processes are robust. And so they've been applied to a number of big changes in London, including the Epsom and St Heliers Improving Healthcare Together programme. But then since the COVID-19 pandemic, the Mayor of London commissioned the Nuffield Trust to do a review of the 6 tests, particularly to make sure that they had a sort of the right proportion around health inequalities, and to strengthen that test, which is one of the 6 tests. So if you flip to the next slide, it shows the 6 key areas that the Mayor's test focuses on. So on any big transformation or big consideration, the Mayor's test will ask particular questions around these 6 areas to make sure that it's robust and challenge the process. So the key revisions that have been published in this month are particularly around the health inequalities test and also the hospital beds test. So if you flip to the next slide. So I've just summarised the key changes. So under each kind of test area, the Mayor's has identified a number of supplementary questions, and it's really through answering these supplementary questions that a proposal can either be determined whether it's passing the test or not. So these particular changes to the health inequality test and to the hospital bed test are around the supplementary questions. So what we see here is a sort of stronger emphasis so the NHS being an anchor institution, so recognising the role that the NHS has in wider determinants of healthcare, and making sure that there's due regard to social, economic and cultural factors in any kind of proposal. Also, a specific reference to structural systematic inequalities, particularly relating to ethnicity and socioeconomic deprivation. So this is really rooted in the findings of that Nuffield report around reflecting on some of the COVID-19 responses to make sure that that is particularly looked at and challenged when any new proposal for the NHS is put in. And again, a greater focus is on addressing health inequalities and making sure that that's equally weighted when any kind of scoring or evaluating or consulting on any kind of proposal. And then a minor change to a supplementary question around the changes to hospital bed tests. So it's again just making sure that if you're reducing the number of hospital beds, that that patient flows or pathways have changed significantly. So there's been credible demographic modelling to indicate that the fewer beds that would be required in the future. So again, it's just about strengthening those tests to make sure they're really robust in light of changes and reflections that we've learned from responding to the COVID-19 pandemic. And then I've just put the actual full supplementary questions for the inequalities test in there because I thought that would be most pertinent for the Health and Wellbeing Board to just see that detail. And I think that the Health and Wellbeing Board would agree that the robustness and the kind of underlying and highlighting of these, particularly of the health inequalities, is really in line with the focus on health inequalities in our local health and care plan and our wider strategies, so that you might welcome the strengthening of these Mayor's tests for any future proposals and around challenging changes to the NHS services. So that's it.
Thank you. Are there any questions? Jennifer?
Thank you. Are we able to add one of our own to the list?
Well, I think you might want to take that up with the Mayor of London, but I'm sure if we would have our own flexibility if we were analysing or scrutinising a proposal that to have a look through your own elements on it, I'm sure. But
it's around accessibility again, thinking about the services we've had locally that have been moved away, arena services going to St George's and new hospital at Belmont. fact, getting to St George's is 2 buses, so it's accessibility that I would consider. Thank you. Don't know if it comes in any of those.
Well, of course, locally, and I'm sure other colleagues would agree, any changes that or proposals for any service changes would be party to a quality impact assessment, which would include obviously areas around accessibility within disability and looking at each of the protected characteristics. But I think the mayor's test just helps provide an additional level of rigour that we could use internally as well.
Well, I had a question that was kind of related to Jennifer's, and that is that in your second paragraph under background, you said that the test framework was applied to the Epsom and St Heliers Improving Healthcare Together programme. Presumably this is before the revisions. When was that done?
So the revisions that were just outlined were published in November this month. So the 6 tests that were applied to the Improving Healthcare Together programme were prior to these changes that I've highlighted here.
My only other comment would be that line which talks about the NHS as an anchor institution. Obviously, the NHS is an anchor institution, but I think in Merton specifically, we don't have a large NHS trust or an acute hospital within our borders. And for me, the anchor in Merton, the constants are the local communities, the practices, the local authority. And I think Merton Health and Care Together, for me, that partnership is the anchor that we need to build our approach around when we think about health inequalities in Merton. So I think I'm not suggesting we challenge the mayor, but I think in Merton specifically that there is an anchor that we need to value and develop locally.
Couldn't agree more, but I think that many of the people that I represent in Ravensbury ward would regard St Helier Hospital as being within walking distance, and therefore their definition of an anchor institution might be different to those that think that the borough boundary should determine whether it is. And I welcome these supplementary questions. I'm particularly interested in the whole issue of the impact of ripping an anchor institution out of a community. And when I say community, I mean community in the not narrow borough sense, but in the broadest sense. You will not be surprised to know that these concerns have been raised previously, and there was also an effort when this decision was being made to delay the decision until there was more evidence available post-pandemic, and I think that's now available, and that's kind of stuff that Nuffield have been referring to. So the position of the local authority is absolutely clear. We are opposed to taking the services away from St Helier Hospital and taking them anywhere else. We'd be delighted to have a new hospital, but we want to see it in and close to the site where there is so much deprivation, and the people really value this and see it as an anchor institution. So and I'm delighted that that's a united position that this local authority has, and it includes the support of the opposition, the main opposition party as well. So that's really good that we are as one voice on that. So I thank my colleagues for that. Are there any other questions? Okay. So we thank you for updating us on that, and it will be interesting to see. I mean, is there any plan to kind of those that have been judged on the previous basis to have another look? Do you think perhaps we should talk to? I mean, you were suggesting that we might want to talk to Mayor Khan. That maybe we will, he's not too far away, and will understand some of the issues that we've raised our concerns about. Okay, thank you. So item 8 is the young inspector invitation to the Health and Wellbeing Board. Dagmar, do you want to briefly introduce this?
Yeah, okay. Yeah, so the paper, the recommendation is very clear. The young inspectors came to the September Health and Wellbeing Board. They brought a particular perspective of young people, and one of their considerations, asks for the board, was to consider membership of a young inspector to enrich the perspective of young people's voice. And so this report now brings back our response in discussion with the chair, that we are proposing to offer a young inspector a place. It's a non-voting place, that we propose to run this as a pilot so that we learn, and start from January till June, over 6 months, 3 meetings. That there will be a bit of a process, so that we have transparency how we nominate the young inspector. There's an outline job description, and that we then have a framework to evaluate, has it added value, and what can we learn, and what do we want to do in the longer term. We've obviously checked with Democratic Services, as we are running it as a non-voting member and a pilot. We do not, as a board, have to change our terms of reference at this. So over to you, Chair, in terms of checking the recommendation. Thank you.
Well, I'd like to give people the opportunity to ask any questions if they have, but my sense is that we had a discussion about this previously, and if there are no questions as a result of the paper, I would propose that we look straight at the recommendation. Yes? Okay, well, can I mean, the recommendation is clear. Can we agree the recommendation that appears on page 21 of our agenda? Great, thank you very much. Well, that concludes the business of the Health and Wellbeing Board. I'd like to thank you all for your attendance, for your contribution and your questions, and take the rest of the evening off and enjoy the second half of the game. Those of you that are interested.